Okay. Hello, everyone. I'm Dr. Vadrine. I'm so honored to have you join us here today for this conversation between myself and my colleague, Dr. Johnson. Dr. Johnson is finishing up with a patient, so she will be with us shortly. We are excited to co-facilitate. We wish it was under different circumstances. However, we do think it's important for us to discuss why the Rona is disproportionately impacting the Black community. Please note that we are also mindful of the other epidemic that is negatively impacting the Black community, which is police brutality. And we share the pain and the urgency of addressing this matter. We do ask that you also keep in mind that this virus is still a novelty and it's seemingly ever changing. And so our information shared with you today is going to be based on information that we've had as of, I believe, yesterday. So we want you to keep that in mind as we go through this presentation. We thank you in advance for your understanding. I also want to share with you that I do have some princesses here with me because this is my home office. And so some of you may have princesses, pirates, or princes in your own home. So I do try my best to help them to understand the importance of giving me some space while I do the webinar. However, I am also mindful of not policing Black bodies. And so I do tell my children, if they need to come in, I allow them. I do my best to redirect them, but it's also a purpose of sometimes providing them with that just emotional security that they need. So I thank you in advance for understanding if that were to happen. But we'll quickly just move through the process. So I just want to tell you a little bit about Speaking Down Barriers, which is the organization that's helping us to be here today. Speaking Down Barriers, we're a team of educators, healers, theologians, creatives, and writers who believe that our differences, though often seen as a source of contention or used as a means to divide us, can actually serve as a source of connection and strength. We believe that we can build and grow across our differences together. So that's a little bit about Speaking Down Barriers. And myself and Dr. Johnson are also with Vadrine Healing Services, which is a company that I helped create. I'm a founder of, and we provide individual, family, and couples therapy, but we also provide trainings and facilitate trainings as the one we're doing today, the workshop we're doing today. So once again, we are honored to be here with you. We are your distant cousins from South Carolina. We're very honored to have this opportunity today. So thank you. What I'd also like to do, like I said, Dr. Johnson is on her way. So I'm going to go ahead and just talk a little bit, if I may, unless Dr. Reader, did you have anything you wanted to tell me before I start a little bit?
No, not at this time. Just give me a heads up when she logs out. I'm looking out for her name so we can include her in the presentation.
Yes, she just texted me saying that she's apologizes, but of course, as you know, she's finishing up with a patient, and they were just having a little bit more difficulty. So she wants to make sure to attend to them before coming to join us. But she is about to log in, so she wanted me to share that and extend her apologies to the participants, who I like to consider to be my family, my internet cousins. So it just helps me be a little bit more comfortable. So we wanted to share this quote with you. This is one of our, the mother of our work with Speaking Down Barriers. Her name is Audre Lorde, and she shared the quote, "Caring for myself is not self-indulgence, it is self-preservation. And that is an act of political warfare." Audre Lorde was very instrumental in the civil rights movement. She was a very prominent figure in the LGBTQ plus community, a womanist, a poet. And when we think about self-care originated, at least in the medical circles. It was really about being mindful of self-management of your illness, its treatment, as well as prevention. And right now, when we think about self-care, it's sad to say, in contemporary time, has been commodified and focuses on sometimes self-indulgence. But with Audre Lorde, she reminds us that self-care is about, it's not just about improving yourself, but it's about self-preservation. And given the times in which we're in today, it's vital that we be mindful of that. She really calls us to see self-care in the context of social justice, as well as understanding the importance of utilizing a holistic approach. Like Philadelphia Fight supports, utilizing a holistic approach wherein we really work towards preserving and enhancing our experience, our life from an emotional, physical, spiritual aspects of our lives, and looking to have that fulfillment. So it's really essential that we keep that in mind when we're talking about self-care. It's not just about it's not just about doing things that makes you feel good. It's really about doing things that's going to enhance your life and preserve your life. Everybody know, I did remind everybody that we're their internet cousins from South Carolina. And so if you want to take a moment and introduce yourself and what it is that you do, just briefly.
Okay. Hi, everyone. I am a pediatrician in a community health center in Spartanburg, South Carolina. I am a South Carolina native, born and raised, and left the state to pursue my education and came back. And I'm here now, loving what I do, loving community medicine, and just very passionate about all of the people that I serve. I know you're not going to let me get by without saying this, so I got to add this in there. That in addition to being a physician, I also dance professionally on the side, although that's on hold right now thanks to the pandemic. And I recently became an adjunct professor with the medical school in the area in Greenville, South Carolina, as well. So wearing a lot of hats right now.
Well, thank you, Dr. Johnson. And once again, we thank everybody for joining us and for your patience. We apologize for the slight delay, but as you know, Dr. Johnson was just finishing up with the patient. And so we really thank her for being with us. So we're gonna go ahead, Dr. Johnson.
Okay.
Are you ready?
I'm ready. We can get started.
All right. So where are we now with regards to COVID-19? COVID-19, as you know, has become unfortunately, a part of our new normal. And we need to accept this reality in order to help us know how to better address this and determine how we're going to be able to move forward in a healthy way, right? So we're going to start off by talking about some of the facts and the implications of COVID-19, otherwise known as the Rona, in the Black community. So what the data continues to show is that the Black community, unfortunately, is disproportionately impacted by this virus. Why is this happening to us?
So, I think it's best whenever we're dealing with something like this is just to start at the beginning. So we first wanted to just start with a timeline of events. This was first identified in December of 2019 in Wuhan, China, when there was many cases of this unknown pneumonia. And then eventually we were able to identify SARS-CoV-2 as the source of this disease. And then in January 30th of 2020, it was declared a public health emergency of international concern. And then by March, it was declared a pandemic. So as you can see, it moved relatively quickly. We are still learning about COVID-19. The virus that causes this is a relatively new virus, even though it's in a family of known viruses that's known to cause mostly the common colds, but this one in particular, we're still learning about. What we know right now is that it's spread by close contact, so that's person-to-person spread, via respiratory droplets, so that's coughing, talking, sneezing. And it's thought that these droplets pretty much travel about 6 feet. So that's the reason why those social distancing guidelines are in place of at least 6 feet apart, because we're really trying to reduce that spread from person to person. It can live on surfaces anywhere from hours to days. And so theoretically, you can get infected by touching that infected surface and touching your face, but this is not the primary means of transmission. So when it initially presented, we were just looking at the respiratory symptoms, and we were just looking at adults because it was looking like children were relatively spared. So we were looking for symptoms like fever, cough, shortness of breath, and difficulty breathing. But as COVID has continued to make its home in our community, we've noticed that that list has become a lot more extensive and is including all of these symptoms that you see here. And what we also thought in terms of children having mild disease, even though that is true for the majority of our cases, we are seeing more acute illnesses and more critical illnesses in our children, represented by this multi-system inflammatory syndrome, with the most common symptoms being fever, rash, and abdominal pain. And these kids are often requiring support in the ICU. Some of them are on ventilators. Some have even had to be placed on dialysis. So even though children do not need, even though they do not seem to be dramatically affected by this, they are still affected and can be quite seriously. So as of yesterday, June 3rd, in the United States, we're looking at a total of about 1.8 million cases and over 106,000 deaths. And that is a staggering number because this is just the US alone. And unfortunately, we're seeing this disturbing trend emerge because these cases and these deaths are not affecting the United States uniformly. And what we're seeing is that African American communities are having 3 times the infection rate and 6 times the mortality rate of white communities. And that is shocking. And to put that into perspective, I put a few cities that have been able to report some of their data. And if you look at Chicago, 50% of the cases, 70% of the deaths, but only 30% of the population is African American. And in Louisiana, you're seeing a similar picture. You have 70% of the deaths, but Blacks only make up 32% of the population. And so even though we don't have all the states reporting all of their data, what we are seeing that's coming in is a similar trend.
You know, Dr. Johnson, I mean, it is very disparate looking at the data, but I think it's incomplete because when you think about, you know, the Black community, we are not a monolithic group. And so I think about members of the LGBTQ plus community, specifically the trans community, communities that are often marginalized in our society. So I'm thinking about potentially undocumented immigrants. And I know the picture right now is primarily undocumented Latinx immigrants. However, there are undocumented immigrants, Black immigrants also, who may not be tested. And then we think about when testing started, it was limited to a certain group of people. And so I think about those communities and how they may not be accounted for because they may be considered insignificant, unfortunately, because of, you know, systemic oppression in our society.
Absolutely. By no means is this comprehensive. And so the sad thing and what I fear is as more data rolls in, these numbers are going to change even more. But unfortunately, I don't think it's going to change for the better because you're right. There is a group, or there are groups of individuals that are not included in this. And so we are not even counting the people that have never been tested for this. We're not even counting people who have it and may have died at home. So there is so much that is missing at this point. So, you know, at the beginning of this, we asked the question, why is this happening to us? And it's a valid question to ask. And when we look at this pattern, you have to think about what is leading to this. And one of the main things that we have to say is these are the adverse effects of social determinants of health. And what does that mean? Well, where we live, learn, work, and play, that affects our health. And I love this graphic because it's a perfect representation of everything that makes up our quality of life. And what is very interesting to see is that only 20% of what happens in your doctor's office affects your health. The other 80% is a combination of your health behaviors, your choices, as well as the physical environment and other socioeconomic factors that surround you. And what you can see on the side of this slide is literally 50% of your health is really determined by your zip code. And so if we were to kind of break this down a little bit further, when we move on to our next slide, you can see these factors broken down in individual categories. And so when we think about health, our health is more than just our physical health or our mental health. But we can't interpret all of these alone. And we have to look at these in the context of systemic racism and oppression and how all of these factors are playing out. And so when we say, why is, COVID-19 hitting us so hard? That's the lens that we have to view this as. And, when I look at COVID-19, this COVID-19 is like the big bully on the playground. He does, or she, if we want, since we're calling her Rona, she does not play well with others. And so what does that mean? If we have any underlying risk factors, any comorbidities, that increases our risk for a poor outcome with COVID-19. And so when we start breaking these things down, it's no longer surprising to see what we're seeing. So for example, if we look at physical health, comorbidities such as diabetes, high blood pressure, heart disease, obesity, asthma, all of those are underlying risk factors that increase our risk of poor outcomes for COVID-19. But these health issues are disproportionately represented in African Americans. So we're already starting at, we're starting behind the line because we're already at increased risk to begin with. When you look at mental health, we have to talk about or consider this chronic stress of racism that we have to deal with every single day and what that does to our immune system long term.
And then also paying attention to if you are a member of the LGBTQ plus community, if you are an immigrant or undocumented immigrant, if you're somebody who may be disabled, if you're somebody who is not a citizen of this country. So all these different layers can further exacerbate your stress level, which we know impacts a person's immune system. Correct.
And then when you look at social economic, there's so many things that fall into this place in this category right here. So you think of poverty, you think of limited upward mobility, whether that's in your finances and your job. You think about your education and what opportunities are available for you for employment. So if you are impoverished and you have limited education, you're often working those frontline jobs. You're in a warehouse, you are in a grocery store, you are in public transportation, you're in all employment opportunities that increase your exposure to the general public. But you may also be in a situation where you may not even have adequate protective equipment to protect you from those interactions. Now, your financial situation is now going to influence where you're able to live. And if we look at these statistics, most of these statistics are in lower income communities where we're seeing these high death rates. A lot of this is because we are living in high density areas where it makes social distancing very difficult to do. We may be living in crowded living conditions. We may have a multi-generational household. And so if somebody does get sick, we just don't have the ability to have someone go into their room and use their own separate bathroom to keep everyone separate. We're also dealing with when we say these dense population areas, we're not even dealing with just homes too. We're thinking about mass incarceration, jail cells, other places where that can spread. And we already know that we're disproportionately represented in the legal system and the justice system as well. You're looking at the characteristics of your home. These may be older homes. They may not be in the best of areas, so we may have poor air quality. So we have all of these factors influencing each other. And when you think of all of those coming into play, there's no surprise of why we're seeing what we're seeing. And so I love this next graphic. This was actually done by Haynes et al. And she is actually, and this was actually on behalf of the American Association, or excuse me, the Association of Black Cardiologists. And they've taken those health disparities that we've just spoken about and provided solutions as to how can we address all of these contributing factors to this outcome. And a lot of these are big global solutions: expanding housing, providing food, because what I didn't include is that in our residential areas, we may be living in a food desert. So we may not have the opportunity or accessibility to fresh foods, to nutritious foods like fruits and vegetables. We may not even have the ability to have transportation to get to those places. So if we're not able to get to our grocery stores, we may not even be able to get to our medical provider as well. So these are so many things that fall into play. So we talk about accessible testing, transportation, policy. So these are big, large global solutions to the situation that we're seeing right now.
And I appreciate you sharing that, Dr. Johnson. You know, the testing piece, when we think back when this initially started, and people were just like, you know, go get tests, right? Or they were very specific as who could get a test. Exactly. And so from what I saw, they were asking questions about, you know, did you travel out of the country or something of the sort? And I think to myself, well, that's interesting, because what if I don't have the money to travel, but I may be working for somebody who just came from a country where they were exposed, but I'm, you know, working in their household. Like, so then we somewhat gave priority to a certain class, unbeknownst to certain people, is what I'm thinking.
And absolutely. And when you think about it, you know, we just look at the first 3 symptoms that I listed. It was fever, cough, shortness of breath. That was all that we were asking at the beginning. And then, of course, any travel, any sort of international travel. And as you can see now, that list has evolved to headache, nausea, diarrhea. So think about all those patients who had those symptoms but were not eligible to get tested because they did not meet the initial criteria. And I think what's also very interesting is one of the articles that I was reading was one of the writers commented on the irony of COVID-19 in the fact that this actually probably started more with the white community who had the ability to do international travel. But because they interacted with minority communities who were on the front line, they were able to transmit that virus to those communities, and those communities be adversely affected, even though they may not have been the communities that were the initial exposure.
Exactly.
And that is, you know, and you're right. And so you're like, we have a community that's being impacted that was probably the community that had the least amount of means to do the international travel in the first place.
Yes, and I think that's so important. And for us to also remember that we talk about being asymptomatic. How many people were actually asymptomatic and, you know, still exposing other people unbeknownst to themselves, right?
Exactly, because at least right now, you know, the CDC is estimating about 30% of people are asymptomatic. So we're walking around, we're feeling great. We have no reason to think that we need to go get tested, but we're positive.
Wow.
Positive. So that previous slide was showing kind of what can be done on a global scale, which is just as important. This slide that we've brought up is, well, what can we do kind of individually? What can we do collectively as a group to make changes? Because policies are great, but policies take time. So what can we do now? Well, if we remember that first slide where 80% of our health has nothing to do with what happens in the doctor's office, and 30% of that has to deal with our behaviors or the choices that we make, we have some agency on what we can do. So we can't necessarily change maybe our environment right away. We can't change our genetics, what we were born with. What we have is what we have. But what we can work on is our physical health. So if we are not exercising, and exercising does not have to be going to the gym, or, it doesn't even have to be working out with weights. It can be, which is great if you have access to them, but it's just being active. So if we're not active, if we're not moving around, it can start with walking. If you have stairs in your home, it can be just going up and down your stairs. If you like to just dance around in your house, it's turning on music and having a dance party for yourself. Just doing something to get that heart rate up, getting your body to move. In terms of your diet, it's, well, what can I do to change it? If you know, I'm sorry, I just kind of, my screen. Sorry, guys.
When we're talking about diet, I do want to ask you this, Dr. Johnson, because you mentioned being in a food desert, right? If I'm in a food desert and if I'm having to purchase my food from the local convenience store or the gas station, I mean, that's really limiting.
It is
challenging for me to have a healthy diet. So how do you propose that we would deal with that?
So we have to work with where we are. In a perfect world, as a physician, I would love to say, I need you to eat your fruit. I need you to eat your vegetables. I need you to get whole grains. I need you to go work out 3 hours a week. That's in a perfect world, but that's not the reality of what our patients may be living in. So you have to meet them where you are. Okay, well, where are you able to buy your food? Because it makes no sense for me to tell you to go to the grocery store if you can't get there. So where are you buying your food? So your example is it's the corner store, it's the gas station. What foods do they have in the gas station that's available? If they do happen to have some fruit there, buy the fruit instead of the one that's in the can, because oftentimes it comes in syrup. And so that's a lot of additional sugar that we don't need. If they have canned foods or canned vegetables, if there's an option where you can get it without the salt or the sodium, pick that one instead and season it yourself so you can control how much salt is in there. If you don't have that option, then you use what you have. If you are able to, like if you have to go to the fast food places, if you have to go to McDonald's or you have to go to Burger King because that's the easiest place that you can go to, well, do we have to pick the French fries? Can we pick maybe the apple slices if they're offered? Can we choose water or low-fat milk if it's offered instead of soda? And since we're in the South, sweet tea. Can I pick a grilled chicken sandwich versus the cheeseburger? So even just trying to make healthier swaps is better than doing nothing at all. Mm-hmm. And then, we have mental health on here because that's just as important. If I am not in a place mentally to care for myself, none of these things are going to work because none of that is important to me. So we have to address where you are mentally and making sure that you take care of that. And so that's recognizing that you need help when you do.
And I'd also like to talk about when we look at wealth, oftentimes we associate wealth with finances, but you can have all the money in the world and not be physically or mentally healthy or stable.
Correct.
And so your wealth is your health on a physical, mental, emotional, and spiritual level. And so that's the holistic aspect of this that's vital. And when we talk about choices, I think it's so important for us to pay attention to our choices. We often hear the slogan, when you know better, you do better. Mm-hmm. I've realized for myself and trying to be mindful about my weight gain and weight loss, it's not that I don't know better. I know not to be eating, a bowl of rice every night, but because I'm Haitian, that's a big thing for me. That's a staple. I know better, but it's really about making better choices. So when you know better, choose better. is what I'm hearing.
Mhm.
And that is essential. When we talk about education, I also want to make sure that people don't think that our education, we're talking about you need to get a 4-year degree, right? That's not
Right.
the essential component necessarily when we talk about education. It could be that you have a certification in something. It could be that you get your 2-year degree. It could be that you're an apprentice. It could be that you're a nail tech. It could be that you're a cosmetologist. Whatever it is, as long as you're doing it in a way that's, considered beneficial to you, that's what we're talking about. We're not talking about necessarily getting matriculated necessarily. So
Right. And we know that your education is tied to your health outcomes. So if you have a skill and you have the ability to go further because your health is going to benefit because of that. Because on so many levels, number one, the more education you have, the better you'll be able to navigate this system that we're dealing with. So you'll be able to advocate for yourself. You'll be able to have what we call health literacy. And you'll be able to understand what your doctors are talking about, and you'll be able to understand what maybe doesn't even make sense. But you will also have more income, and that income can provide you with different opportunities. Eating well is expensive. Any of us know who has gone and bought fresh food, it costs way more money than it does to buy something that's frozen or to buy something just, from the fast food place. It costs way more money. And so if you have the funds to be able to do that, those options are there for you. But also, because we know where we live also affects our health, if we have financially more money, which can come from that education, which can come from that certification, we may be able to place ourselves in a better living situation. So all of these things all tied together and go right back to the source of contributing to our well-being.
yes. And so I do want us to go back to talking about the piece about the physician and how much really affects how our health is impacted by our relationship with our doctor and the choices that we make. So I was wondering if you could talk about that some.
Okay. So even though that's really only 20% of the puzzle, it's still an important piece. And the way that you can help navigate making these choices is to have a relationship with someone you trust so that you and your provider can be partners on your healthcare journey. And so that issues that you come up against, questions that you have, you can go to them and be honest with them and say, help me get to this place. And so we are very picky about a lot of things. We're picky about our mechanic. We are picky about our hairstylists. We are picky about our nail techs. I need us to be just as picky about our healthcare provider, because if you can spend that much time on other things, then you need to spend the same amount, if not more, on who's going to help you be the best advocate for your health, who's going to be there in your corner. And so that starts off with research. Who am I seeing? So if you make an appointment and they give you the name of the provider, find out who you're seeing. Find out because there's so many different providers now. Find out if you're seeing a medical doctor. Find out if you're seeing the physician assistant. Find out if you're seeing a nurse practitioner. These are all different levels of care. But you want to know who you're seeing, because if you are going in with the expectation that you are seeing the doctor and you end up with the nurse practitioner, that's not what you were expecting. It's not that that nurse practitioner is not capable of providing you care, but that's not what you wanted. So if you wanted to see the doctor, then you make sure that you see the doctor, because that's your right.
Well, Dr. Johnson, I appreciate you saying that, because sometimes, unfortunately, in communities that are used to being marginalized, when we go and ask for help, especially in health care facility, it's been my understanding for some of my clients that they don't feel welcome to even ask. It's like I'm asking for too much if I inquire about what your degree is. So what you're saying is we have that right, and we can just ask.
You have that right to ask, because it's public information, and you need to know who's serving you, and you need to feel comfortable with who's serving you. So if you feel like, I feel better with this person, that's who you feel better with. And you should never feel out of place or uncomfortable to ask, because it's your right, it's your health, and you want to know who's taking care of you. And so, go online and look. If they, most offices now have all of their providers listed on their website. So if you're a new patient and they say you are scheduled to see so and so, go on that website and look at them. Look at their picture. Most of us also have bios. Look at our bios and say, oh, I like that bio. Ooh, I don't know how I feel about that. Ooh, go through it. Look at it. Ask your friends, ask family members if they go to the same office. Who do you have experience with? Who did you click with? Who did you not click with? Who did you like? Who did you not like? All of those things are important, and when you are choosing who your provider is, and also knowing what you need. So if bedside manner is the most important thing to you, make sure you find somebody that has that. If you're like, I don't care, you could be the meanest person in the world, but I need you to know what you're talking about, that's also important. Being warm and fuzzy may not be what you need, but you need somebody to know what they're talking about. So don't feel bad if those are the things that you're looking for, because we all have different personalities. There's a reason why there's so many different personalities in the office, because we know that everyone doesn't match with everyone.
Dr. Johnson, can you share with me, because I know we've had situations where sometimes clients are apprehensive to tell us what they want or what they need because of the issue of trust. Has there been a time where you've had a client that you've worked with or a patient that you've worked with that later on you found out that, oh my gosh, there was a whole other thing, but because of the trust factor, that negatively impacted your ability to provide them with the service that they would have needed?
Yes and no. And I've kind of had it work both ways.
Okay.
I've had it happen where, because I am an African American female, I've had some patients and parents who automatically felt at ease because I looked like them. So there was a barrier that was already removed. And so they felt more comfortable just coming right out and saying it. I've had parents feel like because I was a physician, I wouldn't understand what they were going through until I kind of made a joke or I did something that kind of caught them off guard. And then they were like, oh, okay, you're like really cool. And now I feel like I can say this because it's almost like I have to give them permission to be like, is this okay? And then they were kind of like, no. And I'm like, okay, well then tell me why. I was like, that's what I'm here for. I'm not here to judge you. I'm not here to yell at you. I said, I just need to know. And I've definitely said a lot of things of, if I've asked a patient a question and they didn't take their medicine, and I'm asking the parents, why didn't they take the medicine? And I'll say, you're not in trouble. You're not in trouble. I just need to know why you didn't take the medicine. Like, tell me why you didn't take it, because there may be a reason that we can work on, and so then it becomes, well, it wasn't paid by my insurance. Why didn't you tell me? I don't know that it's not paid by your insurance. So tell me, and then call me and be like, hey, it wasn't covered by my insurance. Cool. Now we have a starting point, because now I can either argue with the insurance company to get it covered, or I have to find something that's practical and realistic. So having that trust, once they know that you're not going to be judgmental, once they know that they have a listening ear, that's going to give you so much information in helping take care of them, because now you can start seeing the barriers to the care that you were blind to before, and you can start working within where your patients are to help them get to where they need to be. But if you're not approachable, if you are very standoffish, you're not going to have that open and honest communication that you need to have.
And I think it's vital for patients to feel comfortable to advocate for themselves. Yes. It's okay. And if your physician doesn't like it, they're not the right one for you.
Right,
if your therapist has an issue with that, they're not the right one for you. Right. But due to time, we want to make sure that our internet cousins can ask questions. So I'm going to go through pretty quickly.
Pretty good. All right. And so we're just kind of ending, my part with this slide is kind of, what does life after COVID look like? There's a lot of questions, and we don't have a lot of answers right now. The big question is, do we have immunity to this? And if so, like, how long does this last? Are we going to get reinfected? how generalizable are findings of the research that we're doing when we start getting more results? Just where do we go from here? And this is just a constant, ever-changing situation. This is a moving target for us, and we are learning more and more. But there's still a lot of answers, which does make it very hard for us. We know we have things in the pipeline. We have, vaccine trials going on. We have clinical trials going on. But a lot of these things are long-term, and they're in the future, but they're in the distant future. And so we still want to remain hopeful, even though we don't have all the answers to this, because we know that we will in time have answers to this. But, we're learning more every day, and that's what we need to find comfort in and hope in, and that what we know today is more than we knew when it came on the scene in December. It's more than what we knew when we were declared a pandemic in March. And so we need to hold on to hope that science and research is going to give us more information so that we're able to plan what life will be like moving forward and actually have information to go with that. And so it is important to remain hopeful, even though there's a lot of unknowns.
Thank you.
Yes.
And in remaining hopeful, it's important for us to definitely do a mental check-in for ourselves, a mental health check-in. It's important for us to pay attention to our bodies as well as our emotional state. Once you're aware of your emotional state and your physical body at a baseline, you'll be able to tell when something is off, so that you can attend to it. It doesn't even matter if you understand or if other people understand why you feel the way that you feel. The key is to first and foremost acknowledge your feelings. That is vital. All too often in the Black community, there's an expectation for us to just push through. And so we don't take the time sometimes, or aren't afforded the time, because it is a luxury, but it's essential nonetheless. I want us to see that it's essential for us to take the time and figure out what is going on with us. Allow yourself to feel those things, right? Even the intense emotions that you have. But what I do ask is that when we do feel those intense emotions, set it for a time period where you're going to say, okay, you know what? I'm pretty PO'd right now. And so I'm going to, for the next 15 minutes, I'm going to allow myself to be PO'd. Okay. Explore and create healthy ways to experience joy, even during these challenging and uncertain times, right? That is vital. So important for us to be able to do. You need to honor yourself by acknowledging what it is that you feel, and we need to be intentional and purposeful about creating means for us to experience joy. And some of the ways in which we can do that is for us to find ways to connect with our body and our joy. It's essential for us to connect with one another as well. Have that sense of community where you seek out like-hearted people to have moments of joy and to experience communal healing. That is very important. I want us to think back to, and this is something that I do all the time, Dr. Johnson, especially in the midst of all that's been going on in our nation. I think back to our ancestors, right? And what they overcame in order for you and I to be here today. Okay? They were still able to have joy. Okay, they were still able, they did not have access to healthcare because they were not considered, right? Historically speaking in this nation. So it's important for us to pay attention to that. There's a story that's not being told either as much. When we look at the data, we see the data of how many cases there are in the United States. We see how many deaths have been accounted for. But what we don't know, the number of people who've recovered. So COVID-19 is not an automatic death sentence, but we do know that what's really important is our attitude, our mental well-being, and how that helps set the stage for us to be able to be prepared to combat that if it were to come our way. That's not what we're wanting, but there are things that we know we can do to help build our reinforce our immune system. We need to think about that as well. Self-care is resistance. We talked about that earlier in the beginning of the webinar. Care for yourself in ways that promote rest, replenishment, and healing. This is by Octavia Rahim. We want to share this with you. She is a registered yoga. She's a Yoga Alliance registered teacher. And she said, "Dear beloved Black people, log off, call in, hold yourself, sing the songs that remind you of our collective love, inner power, and magic, of the way our story didn't start here and won't end here. Take deep, unapologetic care of yourself today and always. Rest, then rise. Continue to cultivate a life plan that keeps our breath, freedom, and well-being at the center." And what we'd like to do right now is share with you a quick video by Congresswoman Ayanna Pressley. "Joy in the face of oppression is, in fact, a form of resistance because it is rooted in embracing community, deprogramming self-hatred, reclaiming humanity, and owning one's spirit."
To be intentional about creating space to inform and to experience joy. I do not want us to be apologists about that, because let me just say, people have been, look, I've been robbed of my hair and I lost my hair. And, I'm saying to people, that's nothing new. Hardship is transcendent, hardship is universal. And for the issue of alopecia, of which there are millions of sufferers, certainly there are many Black women. So I've been robbed of my hair, but Black women have been robbed of things for a long time. So we were robbed of our men that were lynched. We were robbed of our children we were separated from at the auction block and, on plantations. They tried to rob us of our beauty by criminalizing or violating our bodies. So that's nothing new. So I'm just going to say that it's all right to stand in joy, because when you are oppressed and marginalized, we give each other so much instruction about the armor that we need to put on to navigate and to negotiate the world and to do it safely. But joy is a necessary act of resistance as well. And because when we were enslaved and we were in the fields, we still had joy and we still had a song in our heart. And that's important too, okay? That's important too. When we have an administration that is looking to undo the gains that we have made, that is looking to exacerbate existing hurt, in a district, the Massachusetts 7th, 800,000 people strong, 53% people of color, 40% foreign born, almost 40% single female-headed households. When this administration is coming for our humanity, for our democracy, for our civil rights and our civil liberties, for my self-agency and autonomy over my body, I'm not giving them my joy too. But that being said, that joy does need to fortify us for the work, legislative work. And so here we are in the Massachusetts 7th, and I'll wrap here. This is a district that is diverse, vibrant, and dynamic. It is also one of the most unequal in the country. Now let me say this. Politicians cannot say that the best policies are informed by data, and then when I tell you that Black folk are in the bottom of every category, disproportionately bearing the burden of every hurt, from poor health outcomes to housing that is not affordable and sanitary, to bearing a greater burden of student debt, to still being unable to attain a mortgage fairly, and all of these things, then you can't deny that. If the best policies are informed by data, and I tell you Black folks are in the bottom of every category, and then you want me to be an apologist for saying that I am fighting for the economic empowerment and advancement and preservation of Black folk. Not only Speaker Pelosi says that she's in Congress for the children, the children, the children. Do any of you say, what about the adults? No. Only women and people of color are asked to be apologists for fighting for their very preservation, which is why when you spoke of Black Lives Matter, yes, this federal government has created a category to further survey and police Black activists called Black identity extremism. Yes, I am an extremist about loving my people. That what politics. No, it isn't. It is hate and white supremacy that is codified through legislation. If we can celebrate the identity of a veteran, if we can celebrate the identity of a survivor of domestic violence, if we can celebrate the identity of someone in the recovery community and say why we need them at the table to make sure that what happened to them doesn't happen to another person again, the solution is representation, and there is nothing wrong with identity. YouTube.
Okay, so we will now open the floor for some questions and answers. Questions and share some answers as best as we can.
Wow. So before we get into questions and answers, first let me thank you, Dr. Vadrine and Dr. Johnson. That was an awesome presentation. What stood out to me was two kind of statements that you made. Health literacy and your wealth is your health. And I said, you know what, that is so true, because also being a woman of color, a Black woman, and have been fortunate enough to obtain a level of education, that I too at times find myself a bit uncomfortable with some doctors at times when asking questions and even having access to things that I need for my own health. So I can only imagine for those who have been less fortunate than myself, the struggle in the Black community to get access to the things that is needed. And so I thank you for both of you for being transparent in your sharing regarding this matter, because it's a problem. And so I'm excited to see some of the questions that's going to come your way, but trust and believe I'm going to be using your phrase, your wealth is your health. So I'm going to
it's not my phrase. I want to make sure. I don't know who made it up. It wasn't my phrase. I just know. It's so true, though. Yeah.
First, let me go into the Q&A box. So the first question is specific to your data. How and where can you cite this data?
Okay, so it comes from a lot of different places. And I will tell you this, as a physician who has access to multiple different sources of information, it's all over the place. And it's very difficult to pull. Main sources, definitely the Centers for Disease Control. They keep a running tally of cases and deaths that's updated usually daily. So if you're looking for just the general numbers, the CDC is a good place to go. The World Health Organization also keeps data. And actually Johns Hopkins University is doing a lot with coronavirus. So those are three really good sources to go to just kind of keep yourself up to date. Other sources for me just came from medical journals that I subscribe to. And like I said, this data is emerging. So there was one article that literally just came out on June 1st. And a lot of these aren't necessarily even available for print publication yet. They're just showing up online first as they're able to get them out. So that's where I'm getting them from. But for the general public, I would say those three sources are going to be the best starting point for you guys.
Thank you. Someone else also mentioned about your wealth is your health. They're going to also borrow it. So someone else also appreciates that phrase. One question is, once a person has been affected with COVID-19, is there a procedure or guidelines in the African American community to follow up on those who've been exposed? I'm wondering, are we being marginalized, or do we really track how the virus is traveling through our community?
Okay. Ideally, there should be contact tracing, meaning once you've been diagnosed, that not only does your provider call you, but that they also, tell you like, okay, you have to let everybody that you've been in contact with know what's been going on so that they can get tested. Now, this is where we run into issues because testing is not easily available everywhere. So there are some, little community events where you can literally do drive-through testing, and you can just say, I want to get tested, and that's all you have to say. And so you don't have to say that you've had exposure. You don't have to say anything. You can just drive through, you get tested, you get your results. But some places are a lot more difficult. If you're going to sometimes to a physician's office or a medical facility, they do want to ask, well, have you had contact with someone? Because part of the problem is we don't all have enough testing supplies. So all of us are not necessarily in the situation to be able to test anybody that randomly walks through the door, because we're afraid that when somebody does walk in sick, we may not have a test to give them. So one of the things that's really important, and I know some people don't want to say it, you have to be honest when you come to the doctor's office. A lot of people feel like if I say I have COVID-19 or I've been around somebody who has COVID-19, they're not going to want to see me. That is not the case, or it should not be the case. I will say that it should not be the case, because if we want to get an accurate representation of what's going on out here, we need to know what's happening. So you need to be able to say, hi, a close contact of mine tested positive for COVID-19, and I am calling because I want to be seen and I want to be tested. The reason we need to know that, though, is because of how it's spread. We do not need a potential source of exposure to be sitting in the waiting room. We don't need, one or two or three people who've been possibly exposed sitting in a waiting room and possibly exposing the waiting room, the staff, and everyone behind the staff in the clinical area. So not that we don't want to see you, but we need to make preparations so that we know that this is a person who is a potential exposure, a potential case, so that we treat you as the potential case, but that you still get the testing that you need. So definitely make sure if there's been a family member that they tell you, and that you then go to your provider or universal screening testing site, if that's possible, to let them know that you've been exposed and you want to be tested for exposure. And ideally, in a perfect world, we as physicians would be calling and checking on you, because we know that you can be asymptomatic. We know that you could have mild symptoms, and then we know that you can quickly turn the corner and end up in an ICU. So we want to be able to keep tabs on you to make sure that if you're getting worse, that now you're ending up in the hospital, in the ER, so that you can get those, to get the support and the help that you need. But if you do end up going to a hospital or an ER, you also have to let them know that you tested positive as well.
I just want to add a little bit onto that. While I am not an MD by any means, I do know some people do not have access to vehicles so that they can go to a drive-through. So I would recommend contacting your local public health centers, Department of Health and Human Services, just to figure out what options are available for you too. And that
exactly. So yes, go on to your health department's website. Oftentimes they'll have it listed where there's some drive-through testing available. If it's not there and your office can't provide it because they don't have enough testing, ask them, well, do you know where I can go? Like, do you have any suggestions of who is doing testing and what's closest near me? Do not be afraid to ask those questions. That's what we are here for.
Thank you. Another question came in. How can you tell the difference from allergies in the coronavirus?
Oh, goodness. I hate it because now, since Corona does everything, it's definitely very hard. Typically with allergies, you are going to have runny nose, you're going to have cough, you can have sore throat because of the drainage. You usually never have fever with allergies. You may feel absolutely horrible, but fever is usually an absent symptom. So if you're having, and at this point, like I said, it's really hard because you don't have to have fever to be tested. So if you are having runny nose, cough, and especially if there may have been exposure, definitely go and get tested. But at this point, from where we stand, it is pretty much completely, it's very difficult to clinically distinguish between COVID and a regular cold and allergies. So I would say if you have a suspicion, go to your doctor and see if you can get tested. Because honestly, we're at this place where, because COVID does so many things, I can't necessarily look at a patient when they walk through my door now and say, I'm not going to test you for COVID.
Okay,
I hope
thank
that
you.
answers your question.
Another question came in specific to Corona also.
Mhm.
It states that, I heard that we are all going to get it despite precautions. Is there any truth to that?
I wouldn't say that we're all going to get it. That almost sounds like a very fatalistic attitude. I definitely think, it's very widespread. And it's, what we know is it spreads more easily than the flu does, but it's not as highly contagious as the measles. So if we take precautions, we can try to reduce that spread. And so those precautions are the social distancing, if you're able to do it. There's a lot of, back and forth and disagreement with wearing the mask. No, it's not perfect, and we know that. But we know that it can reduce the rate of spread. So if you're coughing and if somebody's coughing and at least your face is covered, no, it's not the N95s that we're using in the hospital and in doctors' offices, but it is adding a little extra layer of protection. And if nothing else, it's helping you from touching your face, touching your nose, touching your mouth, which are portals of entry that this virus can access. So I don't want to necessarily say that all of us are going to get it. But there's a high risk for exposure because of the community spread and because of the cases that are there. And we need to do our best to try to protect ourselves. And that's washing our hands, cleaning, and disinfecting, because cleaning is not the same thing as disinfecting. Cleaning is just getting rid of the visible dirt. Disinfecting is actually killing the viruses and the bacteria. So two different things. But if we can do that, we can try to reduce that spread, which is the best that we have right now.
Thank you.
Mm-hmm.
We have a couple of questions that's left. Can someone who's had the virus and can someone have the virus who never developed any symptoms?
Yes. If I'm understanding that question correctly, that would be what we would call somebody who's asymptomatic, meaning they have the virus, but they've never showed anything. And that's the weird thing with this virus, is that we have people who literally have what we call a viral load, a very low load of that virus, and so therefore may not be as infective and may not be showing as much of the symptoms. But that's what we're still trying to figure out, is why we're having some people who are testing positive who are walking around just fine. And why others who have tested positive end up with only mild disease, and then others that end up in an ICU. So there's still a lot of unknowns as to why that's happening, but absolutely you can look great and perfect and be running around and have the disease.
Yeah, that's pretty scary.
Absolutely.
This is not a question, but kind of a comment to affirm what you've been sharing about the Black community. It says, I recently lost my father to COVID-19 in March. As an African-American physician assistant, I can personally attest to its effect of COVID-19 in our community.
Absolutely.
Yeah.
And it's so hard. And to whoever wrote that, I'm very sorry about the passing of your father. I mean, it's hard to hear stories like that. And it's hard when you hear stories like that and you're in the medical community and you want to have more answers than what we have. And it's so hard not to be able to provide those.
Yeah.
It's my hope that whoever wrote that they are able to get some support to help them emotionally, because the grieving process can be very challenging, especially with how things were with COVID-19. People weren't necessarily able to be with their loved one at the time of their passing. So it's my hope that you're getting the emotional support that you need.
Yeah, I agree with that. Another question. Someone stated, I have all the major pre-existing conditions. How do I keep myself safe?
My recommendation would be, of course, try to limit your outings if you're able to. So if you are having to go out, wear a mask. The sad thing is everybody is not wearing a mask. And so in a perfect world, it would work better if everybody was wearing the mask, but it's not. That's not the case. So I would say anytime that you're out in public, even, and I'm very sorry that I keep doing this with my computer. I keep going, it keeps going to sleep on me. Even if you are able, if you have to go out, wear a mask, wash your hands, wash your hands, wash your hands, carry hand sanitizer with you. If you have gloves, wear them, but also remember that if you wear the gloves and then you're touching everything and then you go touch your face and you do everything else, that's no different than you walking around touching things with your hands and not washing them. So don't get a false sense of security of, because I have gloves, I can touch everything and then touch me. You still have to maintain that good hand hygiene. And when you get out, it may be overkill, but when you come home, wash your hands again. You can take your clothes off, take a shower, just to minimize any possible exposure that may have happened. People will tell you if you're getting things delivered, if that's also possible. When you get things delivered, it has to be touched by multiple people. So let it sit out for a couple of days. If you are going to open it up with gloves. If it's things that you can wipe it down. And then you can remove those gloves and then use those freshly clean products, whatever they may be. But really, the best thing that you can do is also limit how many people are gathering together. Because while you can control yourself, you can't control where other people have been or what other people are doing. And so try to minimize groups. And so I know a lot of things are opening up. One of the things that we try to remind our patients of is that we understand why things are opening up. We understand that people have to go back to work and money needs to be made. And we understand that. And we're not trying to take away from anybody's financial security. But what we also want to remind people is just because we're opening up, the virus is still the same today as it was when it first came on the scene. Nothing has changed about this virus. And so we want people to remember that if there's things that you don't necessarily have to do, don't do it. This may not be the time to go back to church if your church is open, if your church isn't able to practice social distancing. This may not be the time to go sit in a restaurant because, different restaurants may have different policies where some people may be wearing masks, some people may not be wearing masks, some people may be wearing gloves, some people may not be wearing gloves. And so there may be certain things that at this moment, we may want to just sit back and just kind of step away from until we get more information of what this spread looks like as the country is opening up, because that's really going to help us figure out how to move forward once more and more people are going back to their regular routine.
I appreciate you saying that, Dr. Johnson, because I do think, unfortunately, with the power infrastructures that be, oftentimes, people can just think that, oh, you know what, we're opening, we have to open, that's what's really important. It is vital for us to be mindful that part of our self-care is being able to acknowledge what is actually happening. COVID-19, like you stated, has not changed just because the economy is opening up right now. And so we have to remember, especially within the Black community, the fact that it's disproportionately affecting us, but also remember our history. If you take a historical lens and look at the relationship between Black individuals in this country and the economy, we see that we have been the labor force and the negative toll it has taken on us. So if you have the ability, I implore you, it's okay to tell you, people ask me, when are you going to be opening up your office so that you can see people in person? I said, well, members of my community are unfortunately disproportionately impacted. So I will not be opening up my office right now for in-person services, but I am open to providing telemental health services. And that's a precaution for myself, my family, and my community, as well as yourself. If you can say that, that is well within your right. If you have to put a mask on and they're telling you not to put a mask on, you can say, well, you know what, members of my community are disproportionately impacted. I do want to work, I will. However, I need to do this to help mitigate the opportunities or chances of me being exposed.
Exactly. Because there was, and like I said, there's new information coming out every day. And there was one of the articles that I'm referring to is an article that just came out on June 1st from the Lancet. And it was talking about the benefit of protective gear, masks, eyewear, and physical distancing. And there's a purpose for that 6 feet apart, because that has shown to be a reduction in the spread, and that we can reduce that spread even more by wearing the mask. Granted, there's more protection with the medical grade N95s than the simple cloth mask, but in the face of us not having any pharmacological interventions right now, so we don't have a vaccine, we don't have antivirals right now, we don't have a medical treatment that's kind of open and available to the public right now. These are the strategies that we have to use to try to protect ourselves and mitigate that spread. So you are well within your right to say, well, that's fine if you don't want to wear a mask, but I'm not going to do this job unless I wear a mask. And I am going to demand that people stay 6 feet away from me, because if I have to work, I want to reduce that infection. I want to induce that infection rate. And there may be some things that you feel comfortable going to and other things that you don't. And that's absolutely okay too. Because you may have to say, this is okay, this is a smaller gathering, they're following protocols and I feel comfortable in this space. But then there may be something else where you're like, I don't feel comfortable in this space, and this one is, I'm gonna bow out because I just don't think this is gonna work for me. And that's also okay, because there's not an easy yes or no, right or wrong answer for this. It's very much a fluid spectrum on what's happening and how we navigate this.
Thank you, Dr. Johnson. So we have about 10 minutes left. So we have several questions. I'm going to ask the remaining questions.
Okay.
Someone asks, well, how can you protest and prevent COVID?
From a public health standpoint, seeing everybody together is a little scary, because we are in a confined space, and you are not going to be 6 feet apart protesting. You can wear a mask for sure, but I think what people have to understand is the risk, is that I'm going to protest, but there's a risk because of the pandemic that's out there, and because of the ability or the inability to social distance, that there is a risk for further transmission. And we also have to be careful. And I'm definitely not saying this as in not to protest, but we also have to be careful that we are the community that's being hit hard, and we're out here. So if we are going to do this, then we need to take the recommended precautions to at least wear a mask to protect us as much as we can. Like I said, it's not going to be as effective as social distancing, but you still want your voice to be heard, but you also have to go into that protest knowing the risks that's involved.
And I'd just like to add to that. And once again, I am not a medical practitioner. However, I do think if you already know that you have pre-existing conditions that make you more susceptible to being exposed and getting COVID-19, you can protest in a different way. It does not have to be through marching. There's other ways in which you can find to protest and still do your best to maintain your welfare and well-being, because that is vital and important and an essential part of self-care too. So I would like to put that out there as well.
Absolutely.
Okay. The next question is, do you have any lessons learned from the HIV epidemic prevention education that we can relate or draw parallels to with COVID?
Ooh. That's a really good question. And I will be honest with you, I don't have a good answer for that. And my reason for saying that is, when the HIV epidemic occurred, I was very, very young at the time, and I wasn't very aware of everything that was going on. So I don't know much about how that unfolded other than, you know, when it came to the United States and when it became a big issue, unfortunately, it was like the gay issue. This was something that affected the gay community. And so initially, when these numbers were increasing, there wasn't a lot of thought, I would say, or a lot of empathy given to it because it was affecting a marginalized community. What I would say is that what we need to learn is that we don't exist in a vacuum. We are not in isolation, and we all relate and interact with each other. And so what affects one vulnerable population affects us all. And we need to apply that to this epidemic, or excuse me, this pandemic as well. Dr. Verdreen, do you have anything that you want to add to that?
What I can say is I'm happy to say that I am not a medical provider. I do not know the answer to that.
Yeah.
I'm not going to touch that. So no, not at the moment.
Yeah. So I wish I had, I do wish I had more information about that one, but I don't, and I apologize.
Let's see. Can Dr. Verdreen give some examples of different ways people can protest?
So I am not big on social media. However, I do know there's some platforms on social media where people are protesting. I believe it's Blackout Tuesday, people are talking about. So I would look at those type of platforms to protest, things that where you can do so virtually. But I don't really have anything readily available to share with people. And it depends on what you mean by protest as well. I am very intentional. For me, I think one of the things that people can do is making sure to engage in self-care. And I'm not talking about self-indulgence per se, but I'm talking about engaging in activities and thought processes that affirm your humanity, especially within communities that are marginalized, right? So we're talking about, you know, specifically today about members of the Black community, but like I said, the Black community is not a monolithic group, right? So you're talking about LGBTQ plus community, we're talking about undocumented immigrants, we're talking about able-bodied individuals who may not identify as Christian or have any religious affiliations, making sure to engage in activities and thought processes that affirm your humanity, that affirm your value, your worth. That is vital. And I think it is a means of resistance because we know that stress negatively impacts your immune system, right? So if I am reinforcing my mental ability to know my wealth, my health is my wealth, if I'm taking care of myself on an emotional stance, spiritual stance, physical stance, that is going to help me and put me in a better position if I am to be exposed by COVID-19. So that's one way that I think is essential to protest as well.
And if I can add something to that, also I think educating yourself, if you're unable to actually go physically protest, I think educating yourself about why the protest is taking place. If you're not familiar with systemic racism, learn about what that means. If you've heard different terminologies such as white fragility, educate yourself about that. And so the more you become educated, the more you can educate others. So there's a saying that says, I think I may be quoting this incorrectly, but teach one, teach 10. So if you're learning about something, you can talk to someone, they can then teach and share the information to 10 people. So the more you learn, you can share that knowledge as another way of protesting. You're just educating people about these various terminologies you may have heard to enlighten those who are unfamiliar and really lack awareness as to what this is all about.
And I agree with you on that, Dr. Reeder, but I also want specifically Black people to be mindful of that. And members of communities that are often marginalized are put to the forefront to educate, and then only to educate and then it not be received, or it be like, well, I don't believe that, or what have you. So be very mindful and intentional of who you're working to help educate. If you don't find that they're receptive to what it is that you're saying, you don't have to continue. Your energy is important. Your self-worth, your value, your time is valuable. So be mindful as to whom you use it with, and who's your gifts, whom you share it with. Because oftentimes it's not always well received, and then you feel depleted or drained.
Thank you. So we have some other questions, but it's past 1 o'clock.
Okay.
So I want to be mindful and respectful of other people's time. And so the questions that's remaining, I could send to you. We can maybe answer them at a later time and send the responses to the attendees who attended this webinar. So I want to thank you all for attending today's webinar. Just hang out after we end. You will be prompted to answer a survey to share feedback regarding today's presentation. So Dr. Vadrine, Dr. Johnson, thank you so much for taking the time out to share on this important topic, and look forward to working with you guys in the near future. Any last words before we end?
I thank Philadelphia Fight for doing these webinar series. It is vital for our community as a whole. I do want to invite everybody to check in with speakdownbarriers.org if you're interested in coming to one of our offerings that we have listed here. Healing Us is a virtual Black space. And then Learning Us is for white individuals who are non-Black or non-white. The reason why we haven't had an affinity group for you is because we believe it's important for those individuals to lead. We can support, but we don't have somebody from said community yet. So thank you once again. Dr. Johnson?
I just want to say thank you for inviting us to speak and sharing what we know about this virus, and just being a part of hoping to help people heal and understand, so that we can move through this as a community more educated and better prepared to take care of ourselves. So thank you.
Thank you.
And thank you guys all for your questions. We really do appreciate it.
Yes.
All right, everyone, have an amazing day and remain safe. Take care.
Bye, everybody.
Bye, everyone.